We're back into diabetes, type 2 diabetes specifically, and we're going beyond glycemic control. So, what do we basically highlight when we have diabetic patients? Let me show you. So, we go through doing the blood pressure, as we all know, and then we do the heights, and of course, the weight. But we're gonna explore more with talking again to Professor Saqib Mahmood. So, we're gonna be there. So after I spoke, of course, about the BMI, and of course we're going to analyze some blood results that will help us with our diabetes, but I came today to talk about a specific case study that you want to tell us about, which we're going to listen and learn, of course, because what we're learning is not just about diabetes, about the kidneys, about all this stuff are related together. Kidneys can go wrong, lipids can go wrong, everything can go wrong when you have diabetes. Blood pressure can go up. So yeah, tell us about some of the cases you've been across. So, hello again, that's Professor Saqib, as you all know.
Hi. So as you remember, Hala, that we had a gentleman who came in to see us yesterday, and he was about 43 years of age, and he was completely unaware about his blood results, and he was asked to make an appointment to see me. And as we started looking at his blood results, first thing which we noted was his fasting blood glucose was 14.1. And then I looked beyond there, and there was his HbA1c, which was 63, right? So obviously he's had diabetes for quite some time, but he wasn't symptomatic. So he basically wasn't aware that he was even diabetic. He had no symptoms whatsoever. He just came in for something else like tiredness or fatigue, and the doctor who saw him gave him the blood investigations, and he marked a few blood tests. So the other thing that I saw in that blood results was a very high ALT, which was about 120. The normal limit is about 0 to 50, which is the liver function test. That was highly abnormal. And then we weighed him, and his BMI was 43, and he was already in his 40s, and he said that his mother was diabetic, and he had particularly very poor lifestyle. He loved snacking, and he used to drink quite a lot of alcohol and beer. And had no awareness of about diabetes, the complications. So the first thing was in the first consultation to give him an overview about diabetes, that no matter that it doesn't cause any symptoms, it is the complications of diabetes, what can happen in future, why is it important to get the handle on diabetes quite early on. And he took it very seriously, because he had seen his other friends and relatives with some complications of diabetes, and he was fully motivated on this occasion to cooperate and to kind of engage in the consultation and to carry on what we advise him to. So looking at diabetes is from a different angle and perspective compared to what we used to do in the previous years, when we used to just focus on glucose. So we know now that glucose is, if at all, it is of the least of the importance if we compare it with the three things, which is lipids, blood pressure, and the blood glucose level. And in his case, all of these things were abnormal. His blood pressure was also not in target range and was not normal. His lipids were all over the place. His weight, BMI, was excessively high. He was in obese class 3 category. His liver function was abnormal, and that was purely due to fatty liver, and that itself is a independent marker of cardiovascular disease. The weight, excess weight, it is, and high blood pressure is, hypercholesterolemia, high cholesterol it is, and to add on the poor glycemic control. So he had multiple risk factors to address to, alongside his intensive lifestyle modification. So we started off by talking to him about his first and most important thing is to modify his lifestyle and his ways of his eating habits and his exercise and everything. So we recommended him to change his lifestyle, to look and watch what he eats, be aware of the sugar content of the foods, to replace the fizzy drinks into just simple water, and to move a little bit more, do exercise, any excuse to just go and walk, and maybe even consider doing swimming or gym, anything that he enjoys. and above all to control the portion size, to avoid snacking, and even if he eats or snacks, he should avoid the processed foods, and to try and eat healthy fruit, and to restrict the portion of carbohydrate, and to have a balanced diet. So all of these things we addressed, and then we came on quite quickly to managing his diabetes and all the risk factors with pharmacotherapy, because it is known that just the lifestyle and dietary intervention will not be enough in a person who has been diagnosed with type 2 diabetes in his 40s. Itself puts him at a very high risk for cardiovascular disease. If we don't intervene with certain therapies with this person, he would probably have an event, cardiovascular event, which may even be fatal at his age. So to start off with, we addressed his weight management, and then after that his blood pressure with an ACE inhibitor, and then statin therapy because his lipids were very high. And then we talked about starting him on 2 agents, not one. So first of all was the metformin, which we said that he can start off slowly and gradually build it up, and as soon as he is tolerating it, quite quickly we need to bring in another agent which will modify and improve his weight as well as reduce his risk of cardiovascular disease. And so we offered him 2 therapies, and one of the therapies that we chose and we discussed, which was more appropriate for him, and he agreed with that, was a GLP-1 therapy. So we offered him and prescribed him once weekly GLP-1 therapy alongside with metformin. And later on we discussed that we should also continue reviewing him on a regular basis. So we gave him information and brought him back in the clinic back in about firstly in 1 month's time to see how he's faring with his given treatment and tolerating the new therapies, and then another follow-up at 3 months to review his all these markers, which are the HbA1c, blood pressure and lipids. So that is the good management of a newly diagnosed diabetic, and what we say is the early aggressive intervention, which may even lead to remission to diabetes. So if we were to not be slack with it and then let the patient go, he may get an event, cardiovascular event, which may even be fatal. So that's what the approach is now. It's just multifactorial approach, not just glucose-centric approach, but to tackle beyond glucose, which is looking after his blood pressure, his lipid, his weight, if there is anything else in the lifestyle like smoking cessation, and then of course glucose needs to be paid attention to with specific therapies. So that is what we did, and let's see what the patient comes back within a couple of months.
Yeah, I think so. It's really important what you discussed is the liver, to check their hearts. All of that leads from diabetes, leads to all those other things. So if you don't tackle it quickly and fast, that can lead to all the other things to go down. It's very interesting. I've seen so many cases. I learned so much, and thank you for everything. I'm learning every day. Every day I see a new case. It's individualized. Everyone has a different case. We have to look into individuals. It's like a patient-centered care. It's just really important. Thank you very much.
Thank you, Ada.
Thank you.